is cancer, new tissue, if you will. Okay, so just some statistic here. It is, I should update this. If you look at the numbers of cases, cancer incident versus death in 2011, which is about 10 years ago, and in fact, your book, I think, is due for another edition, but I haven't seen it. And look at the number of new cases versus death, and separate it based on male and female. If we rely on this 2011 statistic, the number one reported of new case in male is prostate cancer, okay, followed by lung and colorectal. So these are the three important ones in male that you need to know, right? Now, because there are more awareness of the danger of smoking, the number of new cases of lungs, or even people die of lung, has been decreased in recent years, right? And for example, although in male, lung cancer, the causes of death associated lung cancer is number one, if you will. Of all the cancer, lung cancer is considered as most deadly in male and in female. And you take this number reported compared to, say, in 10 years before that, in 2000, for example, it's been lower than that. Is because, you know, people are now aware of the danger of smoking and the risk factor associated with smoking. But nevertheless, lung cancers continue to be high. And you know, more recently, teenagers and young adults now have switched over to you know, vaping as opposed to tobacco smoking. And the effect of vaping has not really known. But you know, there's a big lawsuit regarding pharmaceutical company and how they appear to know that nicotine is addictive, and yet, you know, they continue to advocate, you know, selling this, you know, tobacco product with nicotine in there. So for the male, the top three numbers of cases of cancer has been prostate, lung, and colorectal. Colorectal cancer, this is my research is on this. It's one of the top three of cancer death, if you will. In female is the opposite, of course. Male don't have as much breast development than female, and on the other hand, female do not have prostate, so they wouldn't die of prostate, right? But they would have breast. And again, because of better treatment of female with breast cancer, the number of incidents seems to be lower, and the death rate related to breast cancer has been lower. In fact, some clinicians see that breast cancer might be considered as chronic disease because we have better way to help people if they can detect or diagnose breast cancer very early. But some women, you know, do not you know, do the recommended of cell palpation, feel for lumps and stuff like that. But if you early diagnosis do have the disease outcome. If you detect it very low at late stages, then it's really hard to treat. When it's already metastasizes to your lung, as opposed to you know, when you start seeing it and take action with a small lump, then of course you can remove a part of the breast lumpectomy, or if it's extensive, maybe you can remove the whole breast. Right. Um, in the female, the number of incidents, the top three are breast, lungs, and colorectal. In both male and female, the number one cause of death is lung, followed by prostate in male and colorectal, whereas female is breast and colorectal. And so for future exam Y, it will base on the 2011 statistic. I did try to kind of update that in 2017. The data from the American Cancer Society, and here is the estimated new cases in 2017, and you can still see that for the male, it's still that order: prostate, lungs, and colorectal, followed by urinary melanoma, and so forth. And then in female, it's still breast, lung, and colorectal, still the top three. According to the cancer Society website, the data in 2017. So still those three has been consistently, the top three in males are prostate, lung, and colorectal, and breast, lung, and colorectal in female. Okay. The trends, this is looking at the trends of cancer incident, and I don't expect you to know this, but the American Cancer is looking for the incidence of cancer from 1975 to 2013, right? Of male, female, and both sexes. Okay. I don't expect you to know this. I mean, we call these per $100,000 data. But what I wanted to point out is that starting in 1990, all of a sudden there seems to be an increased numbers of incident, right, of cancers detected. In females, there's going to be increase, but you combine them, that's how you see this dip. But in the male, there seems to be an increased rise, and then it started to fall off. Does anybody know why this might be? Anybody want to know why this might be? Joseph?
Because a lot of people smoke back then.
A lot of people smoke at this time, you said?
Yeah.
Smoke, not really. But why in 1995 a lot of smoking, people started, late 1800, 1900, early 20th century, you see a lot of smoker.
Well, maybe because they inhaled all the pollution that is in the air from airplanes, pollution plants, etc., etc.
So you're saying that here pollution is bad as
Yeah.
opposed to other year. But another important thing that you guys need to think of too is that the cancer one of the reasons why you would say that more adults have cancer than children is because cancer would take years to develop, right? And so just because there's more pollution here doesn't mean that people will have cancer immediately, right? So in other words, if it's related to environmental or cancer, it's probably because of that the changes occurred probably in the 80s, that led to this, 15, 20 years later that there's an incident. But if this is the case, if it's an environmental factor, why does it affect men more than female? Shouldn't you see the bump in female as well? Any other guess why this might be? Okay. In fact, what happened is that this uh, increases incident could be associated with, this is the time in which people started to learn about prostate cancer. Okay. And there were rapidly tests were developing in determine who would have breast cancer. So, prostate cancer. So, there is a PSA test, which is a protein that finds in the blood called prostatic specific antigen in the blood. At the same time, there are better equipment in diagnosing, with male that has benign prostatic hypoplasia, for example. In other words, their prostate is enlarged, and then you have your ultrasounds or different method in detection. So the key here is that the reason why there are increases in the incident because of the detection method is better, right? And down here, it might be the same, but we don't know it. You people don't report it. There's no way for detecting that the male might have breast cancer, for example. Prostate cancer. Okay, so that's why. I won't be around today, but can you send me an email? Maybe we can talk tomorrow. For those who want to, who just sent a message. Yeah, okay. Yeah, this is the person who missed the exam, and I wonder why. Okay, so send me an email. We'll talk. Okay. For missing the exam. I wrote it down. Student who missed the exam. All right, let's continue then. And here, this is kind of reflected in the same time, which around this time in the 93, you can see here around 93, and look at now if we break down the type of cancer, lung, colon, rectal, and prostate, and you can see, whoa, boom, it's really high up there. The question is that if we have a better detecting method, right, or better test of people having or having a precondition for lung or colorectal cancer, would this number be increased, right? Which we don't see that. But here, now it turns out that a lot of these too, this is just reporting incident, but later on it found out that the PSA test, the specific prostatic specific antigen tests in the blood, okay, sometimes will give you a false positive. So in other words, in the blood will give you a false positive. So in other words, in some people, the PSA test is really high, but they don't have prostatic cancer, right? Or, so they might have just considered benign prostatic hypoplasia, and just benign, it means not cancer yet. So I will try to explain you the different benign versus metastatic in a little bit. And in fact, uh, the with the advent of the colonoscopy, now a better way to detect it, whether a person has colorectal cancer or not, it doesn't seem to increase, not because people are now more aware of the colorectal cancer, and they they um, they are taking early precautions measure, for example. Um, it's nevertheless, colorectal cancer has been slowly decreasing over the years, uh, and that people are aware of colorectal cancer and what might cause that. Breast cancer has really maintained very high. Colorectal cancer, but lung is coming up, and this is partly because, uh, and if you look starting from the 1900s, this number trends going to increase. I guess you can think that, oh, the since the 1990s, female or lung cancer has gone up, is because um, one could argue that at this point, woman movement liberation, even though they start, in 1920 or so, but really at this time where women can, start to break out the shells and be really independent. They no longer have to stay at home, and having this freedom to smoke. Not that they don't have the freedom, but liberation associated with that. So in other words, uh, more women start to smoke around this time, and you can see this how this number have been increased. All right. So the word neoplasm, even though I think of it as cancer, it really means new tissue. Okay. And or you can just say, oh, it's a tumor. That's a neoplasm. But not all tumor or cancers are the same. Benign is one is an anatomical term, if you will, uh, to describe. No, sorry. Benign is described as in an anatomical description of a benign lesion, meaning that it is just a tumor or a swelling. Okay, that's what we mean. And of course, this tumor is the increase in size due to increases cell number. So typically, you would see something like this. Okay, there's a tumor that is developing. Okay, a lesion, right? And this is due to what we call increases in cell number. Increases in cell number. So it might start with 5, and then over time, the tumor will get bigger. Right? So when you say tumor, we're talking about this lesion. And the tumor oftentimes is confined. Uh, in other words, there is connective tissue surrounding this. Okay, so we call it the stroma, basement membrane, still intact. So the stroma, basement membrane, surrounding the tumor. Uh, so in other words, the tumor cell still grow within the stroma, and if it's really uh, confined within this one, the basement membrane is considered benign, and it's benign because you can just basically excise this, and then it's gone. Now, when they started to degrade the basement membrane, right? So we'll say when the tumor start. So when we talk about tumor, I'm talking about the lesion here that has many cells. Okay, tumor started to produce enzyme to degrade the BM, that's mean basement membrane, then it is called malignant. And it's called malignant. Malignant, of course, you can see is advanced stage, or it's more dangerous, if you will. Usually, before it reaches that malignant stage, we call it metastasis. Okay. So when a tumor cell, you can say tumor cells here, produces the enzyme that degrades, and so now some of the tumor cell that comes out, okay, you can say these cells started to metastasize, okay, metastasize. Metastasize. Okay, metastasize mean they break the basement membrane, and then they go to the usually they can go into the blood, or they can go into the lymphatic. So that's the two ways, or the two common route of metastasis. Sometimes they can just crawl to nearby neighbor, but to get distant metastasis, then it has to go through either the lymphatic system or into the blood, and that just depends on the tumor origin. Okay, so now you know what malignant and cancer mean. When we're talking about cancer, then most cancer, then when it say cancer is malignant, when it says tumor is benign, right? Tumor can advance to the malignant stage, and then it becomes a cancer. And the reason why it's called cancer, because Latin cancer means a crab, right? And so a crab that looks like this. So they're crawling and like that. And so cancer cells have this characteristic, they send out these extension that looks like a crab. In nomenclature, in naming the tumor, oftentimes it is in an oma, right? It is a tumor, it's benign. If it's malignant, then we call that is carcinoma or sarcoma. Depends on the cell origin. Now, if I haven't talked to you before, which is, and here when they say adenoma, really the word adenome means glandular. And so adenoma meaning a tumor from a gland, if you will, like the mammary gland. So a female, one type of cancer could be, I say one type of tumor is called adenoma, ductal adenoma, right, which is from the duct, if you will. Okay. Now let's say I told you about a zygote, right? So you guys know what a zygote, and the zygote will lead differentiation into the morula, morula to blastocyst, blastocyst, and blastocysts then give rise to what we consider as gastrulation period. This is my condensed versions of embryology. And the gastrulation will give rise to 3 primitive germ layers, if you will. Okay, the ectoderm. The ectoderm will give rise to the skin and the nervous system. The endoderm, which give rise to the ectoming out. So you think of the skin and the nervous system. Endoderm is inner, right? So that gives you rise to the the GI gastrointestinal tract, the digestive system, and the respiratory tract, if you will. So all the other tissue that are between the ectoderm and the endoderm, right, will be considered as come from this mesoderm. So your muscle and bone, for example, come from a layer of cell called the mesoderm. The ectoderm will give rise to the skin and the nervous system, for example, whereas this gives rise to the inner lining of the GI and respiratory tract. Okay, and everything else is known as the mesoderm. So the mesoderm will give rise to, say, bone, muscle, cartilage, all that come from the mesoderm. So keep this in mind: the ectoderm, endoderm, and meso. Meso means middle. Okay. Now, if it's malignant cell that are usually epithelial origin, and epithelial origins are either ectoderm or endoderm, are usually epithelial origin. We call that as carcinoma. Okay, so when you say, oh, say keratin carcinoma or colorectal carcinoma, we are referring to the cell that is coming from the epithelial origin, okay, which is derived from the ectoderm or the endoderm. So this is the epithelial origin. Whereas sarcoma is cells come from mesoderm. So if you have malignant cell of bone, you call that osteosarcoma. If you have malignant cell of the muscle, for example, we call that rhabdosarcoma. Is everyone clear with that or no?
I'm sorry, can you repeat that just one more time for me?
Okay, good.
Thanks.
Now, if its malignant cell come from the epithelial origin, right, we say it is carcinoma, right? And so colorectal is from the endoderm, right? So you can say, oh, it is a colorectal carcinoma. It's the word carcinoma. Now, if the malignant cell come from mesoderm, right, like the bone and the muscle, then you would say that's osteosarcoma, right? Or is muscle, we call that rhabdosarcoma. All right, now I think this will probably help you in naming of tumor. Again, the difference between malignant and benign is still, you can say anatomically, it's confined, right, it still has the stroma around it. Malignant meaning that they have moved, they have metastasized. Malignant, you can say, oh, it could be a physiological description or a clinical description, whether they have metastasized or not. Okay. Whereas the tumor benign, anatomical description could be, oh, how big is the tumor? Is it 1 centimeter? It's less than 1 centimeter? Or you can look at the lesion. In the middle of the lesion, is it bloody, right? Or is it not bloody? And look at the center of the cell. Are the cells dying, right? Necrosis, or are they still intact? How about the cells, the number of cells that are dividing, right? Dividing cells known as mitotic cell. Are there a lot of mitotic cells or there are no mitotic cells? Okay, so that's anatomical description of benign, whereas malignant is more clinical description explaining where the tumor has been metastasized to the other site as well. Now, if it comes from the fat, for example, or fibrous, we just say, oh, lymphoma. You see that if it's fibrous tissue called fibroma, like fibrocyte called fibroma. If it's bone, it's osteoma. If it's cartilage, it's chondrioma. If it's blood, it's hemangioma, right? If it's muscle, it's rhabdomyoma. If it's smooth, then it's leiomyoma. If it's epithelial, it's usually considered as papilloma because it produces finger projection called papilloma. If it's glandular, it's known as adeno. Okay? Adenoma or other types is papilloma. A lot of the tumor, benign tumor of the melanocyte is known as nevus. Nevus, okay, kind of like a freckle, if you will. So see the name Oma is all benign, okay, with the exception that in this case of the skin, when you see this melanoma, even without malignant, all melanoma, all malignant, if you will, okay? So that's why they call it malignant melanoma. But all the other description in terms of benign versus malignant is that if it's fibrous tissue, right? Now, fibrous tissue come from mesodermal origin, then the malignant will be then, we would call them as fibrosarcoma. If it's fat, it's liposarcoma. See that? If it's bone, of course, mesoderm is known as osteosarcoma. If it's cartilage, it's chondrosarcoma. If it's blood, it's hemangiosarcoma. And here, if you go down here, we say is epithelial origin, right? Epithelium, it would be squamous cell carcinoma. You see how carcinoma is refers to the epithelial origin, right? Well, all the other one, it should be sarcoma, except, of course, in the blood, where it has a description where you can have leukemia or lymphoma. If the cancer cell, right, in this case, confined within the lymph node in adult, this is known as lymphoma. If it's more in the blood, then it's leukemia, right? Now, children tend to do not have a lot of cancer, but if they do have cancer, it usually finds in the blood, right? So children will have children leukemia, or they can have lymphoma. There are some children that might have some nervous cancer of the nervous system, and that's just when they're born with it. They might have, say, RB rhabdomyoma. They may have a tumor in the back of the eye, for example. Okay, that's very common. Yeah. Okay, are there any questions? Okay, let's move on then. Causes of cancer. Neoplasm can be characterized by epidemiology, of course. In any case where when you look at the patients, you always have to look at their history, okay? But I would say that, one of the exam questions was that diseases are brought on by, is it genetic alone or is it environmental, or it is both genetic and environmental. In fact, cancer is similar way that it takes, two, that usually there's a genetic component and there's an environmental component to it. So environment factor can stimulate cancer development. But I would say that the root of all cancer is DNA damage. Okay? I'm going to say DNA damage. Okay, so there is a hypothesis known as the two-hit hypothesis. Okay. Now this refers to two events must happen before a tumor develops. Before a tumor develops. Okay, so that you have to have two things. Okay, two things, and it's kind of attempt to address this idea that if we say that smoking increases the risk of developing lung cancer. Their epidemiology study have shown that. Okay, and so basically what we look at is, we look at the number of people, smoker versus non-smoker, and you can say smoker, within the smoker population have lung cancer. Or in fact, what you could do is you can just say people who have lung cancer and say, okay, have you smoked before? And most of them would say yes. And how much do you smoke? Oh, I smoke a packet a day, for example. Versus, someone who have lung cancer who never smoked. And you say that there are few people who have lung cancer if they not smoke. And so epidemiology study have shown then that there are correlation between smoking and lung cancer, right? And then you can have people like George Byrne, who's then smoked up, cigar up to his 80 years old. And then he doesn't develop lung cancer. And then you say, oh, okay. Why? If that is the case, how come he doesn't have lung cancer, right? So that's what cigarette or tobacco industry wants you to believe, is like, yeah, what are you guys studying? It's baloney, because here's the guy who smoked all his life. He never developed for some reason I keep thinking breast cancer, lung cancer, right? Yeah. And then on the other hand, you can have a secondhand smoker who, a smoker does not develop lung cancer, but a person who lives in a house with a smoker develop lung cancer, right? And so then there's two-hit hypothesis, meaning, okay, now let's say in the secondhand smoker, they're born with and mutations in the DNA themselves. So that's one hit, right? One hit already. And by having live in an environment where there's a lot of carcinogen or compound that is in the cigarette or in the smoke, that facilitates it. That's considered a second hit. Therefore, that person developed cancer. And in the case with George Byrne, is that he never had that one hit. That's why he doesn't develop cancer. But if you already born with a defective gene, right, then environmental factor can stimulate it, cancer development faster in that person versus another person who have normal gene, for example. In the case of breast cancer, for example, now many studies have, shown that breast cancer can cause by the gene themselves, right? So the question has been, is it the gene or is it environment? And the work by Mary Claire King at University of California, Berkeley, whose mentor is Alan Wilson, and who, by the way, was my mentor when I was an undergrad there in the 80s. I got my BA degree in 1989. I guess that's like before many of you guys were born, I guess. But Mary Claire King had her work was actually based on genealogy and looking at a female who has breast cancer and whose mother or aunt or grandmother has breast cancer. So this is, of course, before 2000, where the Human Genome Project then started to show every genes in the bodies, right? We didn't know back then, and but she started mapping and looking at the within the family that have breast cancer. So her discovery, her study actually leads to the discovery called BRCA, BRCA1, okay, 1 and 2. But typically, if a person who has a mutation, BRCA1, BRCA for breast cancer associated cancer gene, if you have a mutation, female have a mutation in the BRCA gene, you will, I think, pretty much know that you will develop breast cancer. And people like Angelina Jolie, who have a mutation in the BRCA gene, chose to, if you want, you don't want to have breast cancer, so you can remove your breast, mastectomy. And because many women who have a mutation in BRCA1 and BRCA2 also develop ovarian cancer, and you can also choose to remove that as well, ovarectomy. So you can get mastectomy as well as ovarectomy. So that certainly is a predisposition. Genetically, is predisposed the individual to that, and many studies have shown. When I at UC Berkeley, I was in the lab, and they were asking the simple question: does the Western diet increases the not the development, because what they do is that you can have mice that you can treat them chemically, so that's one hit already, and then fed environmental things like a high-fat diet can lead to faster development of mammary gland tumor, for example. And certainly it shows that yes, that's why diet in high fat content increases the incidence of breast cancer. So perhaps that's a reason why more women live in westernized uh, countries have breast cancer than in in non-westernized in Asia, for example, or in Africa. But that doesn't mean that people, Asian woman doesn't have breast cancer. They do too, but that higher fat content add to that. And I think it might relate it to that if you have high fat content, you might have more of steroid, like estrogen, and that is the driver of breast cancer, is the presence of estrogen, if you will. And then we can talk about how tumors change. Let's do a couple more and then we'll take a couple-minute break. What are the causes of cancer? There are certainly many causes that you can see here, but what all of these things does ultimately is to damage the DNA, particularly UV light. Okay, UV radiation. This is how we kill bacteria, and that if you just take any number of product, if you want to kill bacteria, you just turn on the UV light, and that's it. It cross-link the DNA, and they can't replicate and they die. That's why if you love the beach and you go to the beach for many years, over time, you can have a cumulative effect of sunlight damage your DNA. And then again, epidemiology and study shows that people who spend many hours at the beach likely to develop melanoma than people who never go to the beach, for example. So again, you use sunlight protection. Radiation, we know this is true because Chernobyl, right, in Russia, leakage of all that radiation, and you can see that, increased people develop living in that area will have different kinds of cancer, particularly the blood, if you will, lung cancer. Sometimes some of the nitrogenous compound that is used to preserve food, and this is particularly one of the reason why that people say, well, there's a high incidence of uh, stomach cancer in Japan, is because they've been eating for many years of all the preserved food in the stomach cancer. But then again, people say it could be related to bacteria, like the H. pylori, for example. Again, it's an environmental factor. Some viruses have known to infect the cells and can cause the cells to proliferate uncontrollably. HIV does this, that can lead to compulsive sarcoma. It's one of the signs that you often see in people with the advanced advanced stage of AIDS, and then they have, we'll call it the Kaposi sarcoma, which is basically a tumor of the blood vessel. Okay, so that's a virus that can infect that. A lot of these industrial carcinogen can cause urinary bladder cancer, and there's a famous study that shows that, interestingly, how in the 18th century, 19th century, 1800s, there were not a lot of urinary or bladder cancer, but with the industrial revolutions, when you start to use a lot of chemical and people are exposed to that, and what happened is that your kidney will filter those substance, but our urine with the toxins and stuff like that, those chemical, it stores in the urinary bladder, but it doesn't get void. And so having that extended exposure to these carcinogen in the urinary bladder, that's where that's explained why the incident of bladder cancer. Of course, some of these bladders, particularly in Africa, is might be increased, maybe related to certain parasite that they get. Raquel?
Yes, Professor. Is there any like correlation have you heard of as it relates to one like holding up their urine, for consistently, like they don't use the bathroom that frequently, even when they feel the need to urinate?
Yeah. Well, we're going to talk about the urinary system, but incontinent, usually there could be a lot of stuff. So there's a maturation reflex. I don't know what you mean. It's part of the parasympathetic nervous system in which there's a stress in the urinary bladder that sort of like sends the signal to the brain, say, is an urge for you to void. And because of that neurological damage, particularly you know, you might see this in pregnant women too, how because the she's carrying a fetus is getting big, it could press on that certain of the nerve, so that she can get leakage, or so anytime where people have spina bifida, for example, can also have a problem urinating as well, because that's a neurological damage that can contribute to that as well. Yeah. Yeah. Does that answer your question?
Yes, thank you.
Okay. And of course, now we know that women who have HPV, human papillomavirus, how this is a virus can stimulates the cell, particularly the cells at the cervix. So HPV infection can lead to cervical. By the way, do you call this cervical malignant cell as cervical carcinoma or cervical sarcoma? Joseph?
Isn't it a carcinoma?
Carcinoma, yes, is correct. Answer is carcinoma because of epithelial origin. Okay. All right.